Hey guys, welcome back to Medical Coding with Blue. It is Vlogmas Day 1. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. For the next 25 days of Vlogmas, I am going to be talking about modifiers. So I'm going to be leaving the informational links that I'm using throughout this series in the description box so that you have additional resources to look at and refer back to. And if you are just learning, I know it is a lot. Even if you're a veteran coder, I know it is a lot too. But really understanding when to apply these modifiers is so helpful, and it tells a lot more of the story. So it gives the procedure codes and the E&M levels a lot more depth, because the trained eye will be able to understand what actually happened. And not only that, it can ensure proper payment. It can ensure less headaches if everything is submitted appropriately. So I hope you all enjoyed the series. Please leave a comment. Let me know how you are, where you are in your learning process. And I hope you all enjoy. And so let us begin. We're going to start with modifier 25, because what a better way to start off a 25 days of modifiers than with modifier 25. So I'm going to be reading from the Novitas website about modifier 25. It's a modifier 25's tips. And I just want to let you guys know that the definition of the modifiers, a lot of them, is in Appendix A of the CPT Professional Edition manual by the AMA. So I encourage you guys to read that and look over it to try to really understand what's happening. But just know that modifier 25 is applied to evaluation and management codes only when it is appropriate. Now, why do we have modifier 25? Well, it's important to understand why we need this. So minor procedures, those procedures that have a 0 to 10 day global period on them, have an element of evaluation and management built into the code. So whenever a patient comes in and is having a minor procedure done, just say, for example, they're having a joint injection, right? An arthrocentesis, they're having that done. And that is a minor procedure. Now, how do you find out what the global days is? There's a lot of websites that will help you with that. I will leave a helpful website for that in the description box of this video, so that you can just punch in the procedure code and it will tell you how many global days are on that procedure. So it's very helpful. But with these, right, if the provider decides to go ahead and do an injection for a patient's pain, let's just say, for example, they have osteoarthritis of the knees, and they decide to go ahead and do an injection, they're saying that you cannot get an evaluation in management because the provider decided to do this minor procedure. Again, evaluation and management is already built into the minor procedures. Now, if this same patient says, well, you know, my left shoulder hurts and I've had problems with it in the past, but it just doesn't seem to get any better. So the provider says, okay, well, we're going to go ahead and order additional workup. We're going to send you to get some more tests done on that. We're going to try to get you into physical therapy as well and see if maybe that can help. So with all of that, that is significantly separately identifiable evaluation and management service outside of this minor procedure that they're performing on the knees, right? So that's what you kind of have to picture in your mind, like it is something completely separate from this injection that they're performing, this minor procedure. So with this additional workup is going to be based on the documentation, based on whatever it is that they are doing for this patient. Now, I will say this, in the outpatient setting, as we all know, January 1, 2021, there was the update with evaluation and management. Now, if a provider is wanting to get an evaluation and management based on time, they do need to state that this time that they're having for this evaluation and management level is exclusive of the procedure time, because the procedure time cannot count along with that evaluation and management. And make sure that it is separated out on documentation. It doesn't necessarily have to be on different documents, but it does need to be separated out. This time is exclusive of the procedure that is performed today. And then a brief overview of why it took this extended amount of time if they are wanting to get an E&M level based on time for the shoulder condition. So I'm just going to throw that out there. But without further ado, I am going to read from the Novitas website, modifier 25 tips. Now, if you don't know what Novitas is a, well, I had the, here it is. Novitas Solutions provides high-quality, innovative administrative services for government-sponsored healthcare programs and serves as a Part A, Part B, Medicare Administrative Contractor, or MAC, under multiple contracts for these Centers for Medicare and Medicaid Services. So they have a very helpful website, and they have this Modifier 25 tips sheet. And it says, Modifier 25 is defined as a significant, separately identifiable E&M service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. Often questions are posed regarding whether to bill an E&M visit on the same day as a procedure and or other service with Modifier 25. The following is based on the question, why is a patient being seen? Are there signs, symptoms, and or conditions the physician or other qualified healthcare professional must address before deciding to perform a procedure or service? If yes, based on the documentation, an E&M service might be medically necessary with Modifier 25. Example, here we go. An established patient is scheduled or was scheduled to follow up for a follow-up E&M after a change in his blood pressure medications. The physician met the documentation requirements for 99213. The patient then complained that he was washing dishes, dropped a glass, and now his thigh muscle felt like a piece of glass went through his skin. Based on the signs and symptoms documented, the physician performed 20520, removal of foreign body in muscle or tendon sheath, simple, which has 10 global days. The proper billing would be 99213 with a 25 modifier and 20520. Now, why is this? Because this is two separate things. There is a significantly separately identifiable evaluation and management service happening here because the patient was there for their blood pressure medication, correct? And with that, he's there and he says, oh, hey, doc, you know, I have I dropped a glass, and then they find out that he has this little piece of glass stuck. So they went ahead and got it out of there. And that is considered a minor procedure because it has the 10-day global period on it. So there's no evaluation and management for that part because he decided to do that minor procedure. That 99213 has nothing to do with the removal of the glass. It has everything to do with the medication review for this patient. So you see how there's two separate things going on. It's his blood pressure problem, and he's got this embedded piece of glass that gets removed. So that is how you can think to separate and how the provider can end up with an evaluation and management with a 25 modifier with the procedure that was performed in that day. Now, obviously, if there's no procedure performed, then obviously you're not going to use modifier 25. This is only when you have those minor procedures done on the same day in conjunction with that evaluation and management that you're trying to submit for payment. So the other one, it goes on to say, were the physicians or other qualified healthcare professionals' evaluation and management of the problem significant and beyond the normal preoperative and postoperative work? If yes, a E&M may be billed with modifier 25. If no, it is not appropriate to bill with modifier 25. Example, an established patient sustained a severe laceration to his scalp. Before suturing the laceration, the physician performed and documented a comprehensive history and exam to determine if the patient sustained neurological damage. So you see how we have two separate things going on here? We have an integumentary system problem, right, which is that laceration. And then we also have him looking for a neurological problem because he wanted to make sure that there was nothing neurologically wrong with this patient. So he did the comprehensive physical exam and workup to make sure that everything was okay. There's two separate problems that are being addressed here, okay? The physician then performed a 3.0 centimeter intermediate repair, 12032 is the procedure code they used, to the scalp. Based on the signs and symptoms and conditions documented, the physician went above and beyond the normal preoperative work. The proper billing would be the procedure code 99215 with the 25 modifier in this example, and 12032 would be the procedure code that would be reported. So they do say that it is not necessary to have separate diagnoses in order to report an evaluation and management with the modifier 25 and a minor procedure code. So that is an example of it's one diagnosis, but it is being reported with both of these. And so based on the documentation, they will be able to see that distinction. This is why documentation is very, very important. I'm just saying. Then the other thing it says, it goes on to say, was a procedure or service scheduled before the patient encounter? If yes, it is not medically necessary to bill for an E&M with a modifier 25. Example, the patient was scheduled to have a lesion removed from her right leg. The physician examined the lesion, infiltrated the lesion with 1% lidocaine. The lesion was removed and a simple closure 11401 was performed. The sole purpose of the visit was for the lesion removal. Therefore, billing and evaluation and management with modifier 25 would not be appropriate. Okay? Is there one or more diagnosis present that is being addressed and or affecting the treatment and outcome? If yes, bill the procedure code and the E&M with a modifier 25. Medical necessity must substantiate the use of the modifier. Example, an established patient visited her internist for a follow-up of hypertension and diabetes. The patient also complained of shoulder pain. Watch what happens. The physician performed a problem-focused history and exam, evaluated the patient's hypertension, and determined that the blood pressure was higher than usual and adjusted the medication regimen. The patient's blood glucose was normal. The physician also evaluated the shoulder and determined that the patient would benefit from an arthrocentesis. Just like my example at the beginning. Okay, the physician evaluated the shoulder before performing the arthrocentesis, but also evaluated other problems, the hypertension and diabetes, and based on the documentation, billing an E&M and the procedure in the same day with a modifier 25 appended to the E&M would be appropriate, okay? Because again, this is separate things going on, and it is the provider having to have cognitive work taking care of a different condition, okay? In this case, it was two, hypertension and diabetes, and also looking at the shoulder getting the arthrocentesis, so that being a minor procedure as well. So again, if you're curious about how many global days a procedure has, be sure to visit that website that I'm going to be leaving in the description box below, so that way you can check it out. It is also listed in the encoder. If you're using encoder software, a lot of times it'll say 000, or it'll say 010 at the end of the code, or it'll say 090. And when you see 090, you know that that is a major surgery, or it has a major global package on it. That means it has 90-day global period to it. So clear as mud, right? But I hope you all enjoyed this, and I hope it makes a little bit more sense now. Again, it's just going to take time to learn these modifiers, and take the time to review the books, make your flashcards, please. And also do your own Google search and look at the different websites. Now, on this one, it says that they didn't need more than one diagnosis, that it could be on one. But you have to watch out because some insurance companies are kind of funny about this, and they do not accept that. If you are going to report an evaluation and management service and a minor procedure code, then for some insurances, you have to have two different codes. They don't accept it's just one code and it can be like that. No, like how this website was talking about, for other insurances, that's not the case. So more fun, right? But that's my show for today. So again, I hope you all enjoyed it. Hit that like button if you enjoyed this. If it helped you, that would be great. Share it because it may help somebody else. And I will see y'all on the next episode. Bye.